friends. I have the distinct pleasure of sharing space with a remarkable physician and human, Dr. Deepak Thekkoott. But we're not here to talk about medicine today. Today we're going to talk instead about his new book, Silk and Clay. But it won't just be confined to the pages of this book. We're going to explore together those murky liminal spaces between body and soul, between pain and joy, and what happens to a body and soul on the other side of cancer. So this interview is going to be a little bit different. We will be in conversation about the book, but we'll also be experimenting and experiencing together several of the meditative practices that so much of your story turns on. But before we get there, I'd like to introduce you. Dr. Thekkoott is a renowned international cardiologist with 7 board certifications, living in Brooklyn now, with a career journey that would make any MD or aspiring globetrotter, for that matter, envious. Starting with his medical education in the south of India, in the beautiful seaside town of Kerala, which bloomed into a fruitful career, including practices in Zachary, Louisiana, London, and the Maimonides Medical Center in Brooklyn. He's a fellow of both the American College of Cardiology and the Royal College of Physicians, but for the last 5 years or more, he's been on a journey of a different sort, one that took him to the very brink, and is the subject of his new book, Silk and Clay, A Physician's Journey of Cancer, Survival, and Restored Faith. Dr. Deepak Thekkoott, it is so lovely to be with you today in this space.
Thank you, Kate, for this opportunity. I love to be here.
I'm here as a reader and a fan, but also as a student. I have been on my own meditation journey in a while, so I'm very interested in wading into those practice waters with you later.
Yeah.
But I want to talk about the book first, and it opens with a story of a pain in your leg.
Yes.
And which turns into the cancer diagnosis, and you having to move from physician to the one in need of healing. Can you talk about that moment?
Sure. So it was winter time, 2018. It was a usual Monday clinic day for me. I didn't know those days, Mondays were my procedure days. So these were easy procedures, especially affecting the legs, because sclerotherapy, and I've been doing it for a long time. So I'm well versed with the procedures, so we take these days as easy days, easy procedures. We know the patients well, and we catch up on paperwork in between. So it's kind of days we look forward to. So it was a Monday, and the day was progressed very well. And my last patient is a lady I've known for a long time. She's very pleasant. She's elderly, and she was on the table. Nurses prepped her leg for the procedure. And I walked in and I said, "Hi, Mrs. So-and-so, how are you?" And let's start the procedure. And I was just standing by, and then they gave me a chair to sit on for the procedure. Not quite a chair, it's like a stool. And sat there, and something happened to me at that moment. Very distinctly remember, my right leg started having pain, a very distinct, kind of a crampy, a deep pain. And I am like, okay, I have to do something about this pain before I start the procedure, because once I start the procedure, then obviously I can't deal with the pain. I said, okay, Miss So-and-so, let me get up and do a little stretching, and I'll be back. And she said, okay, go do the stretching. So I walked out. My office is next door. So I walked through the corridor into my office, and I started stretching. So it went on for some time, and my nurses were curious what happened, what is happening to me. So they came by. Then my office manager came by. Then my attending colleague, who was doing a clinic on the next office, came by. And they were, by the time they reached, I was on the floor, I was sweating profusely. And the pain was so deep, my mouth was dry, I could barely talk. So obviously they knew This is not a regular pain,
Sure.
stretching pain. I said, okay, Deepak, you need to go to the emergency room. And my partner said this could be a slip disc. And that can happen. When the disc is slipped, it causes profound pain, especially in the legs. So they took me to the emergency room, which I've been so familiar. I've been in that hospital as a cardiologist for close to 10 years by the time, so I knew everybody in the emergency room, the attendings, the nurses, the staff. So they immediately got me into this room and put IV lines in me and started giving me pain medications and everything they can think of because the pain would not get better. And they started IV fluids on me, then sent me for CAT scans and blood work, and it was just a rush of things. So they saw me in so much pain and they wanted to find out why. So it took 25, 30 minutes. I had all this tests done, blood work and a CAT scan. They rolled me straight to the CAT scan and then I was back. All I could think is I'm still in pain, my mouth is dry because of the medicines. And I'm just laying there and the ER attending was a friend of mine. His name is Brent. He came by. Brent just walked in. He didn't look at me and said, Deepak, your CAT scans are good, but your blood count is not good. It's very abnormal. So I couldn't really think of why. And he said, your white count is 83,000. And you have a lot of blast cells, and blast cells means malignant cells most of the times. And 83,000 is 10 times more than normal. So then he said, Deepak, this could be a mistake. So he wanted to console me. He wanted to make sure this is not a proper result. There might be a mistake in the way they looked at the blood work. And so he said, let's get another sample. So this lady comes in, draws another sample. She walks out and I just wait. But something in me was telling me with this pain and this result, the result may be the right result, not a mistake by the lab. And 5 minutes later, he walks in, he's definitely not looking at me. He's looking sideways and said, Deepak, the result is unchanged. You still have 83,000 white cells and 13,000 or 13% blast cells. So I looked at Brent and said, Brent, can I have the result? So he gave the result to me and I looked at it. And I was looking at what is the blast cells and what kind of cells make up all these 83,000 because I know a certain amount about hematology and cancer, so it was all myeloblasts. That means it's myeloid leukemia. So it is acute myeloid leukemia, which is not a good diagnosis. I mean, I was working, within an hour I'm diagnosed with this acute myeloid leukemia. And what I was experiencing is what we call blast crisis. Once my bone marrow is so busy producing cancer cells, it is swelling, it's expanding my bone. So unless I do something about it, the pain is going to be getting worse. So Brent said, Deepak, we need to get you to a hematology place, a cancer floor. So I called my friend, Mike Castine. Mike has been a friend for a long time, very experienced hematology. I called him myself, Mike, looks like I have AML. He was shocked. Deepak, what are you saying? He said, yes, Mike, I have AML. Then he said, Deepak, we can't leave you there. We have to get you to a cancer floor in the next big hospital. So that's when I was moved to the cancer floor of a regional hospital called Baton Rouge Medical Center. But what I was distinctly remember is through that initial shock, maybe I was shocked. I wasn't scared for any means. I was worried about my family. And that's really the only thing came to my mind. How is my wife and my son going to deal with this? You know, anything could happen to me, but that really didn't bother me. But how is Deepa, my wife, going to take this news, and my son going to take this, and how are they going to move forward without me? Because I kind of assumed I might not come through this. Having seen many leukemia patients don't survive, you don't see many leukemia patients going around saying hi to other people. They, generally, they don't do well. And that was my understanding, but now I know science has changed things, yeah. And so I wasn't scared, but I was scared for them. Another distinct memory I had, which I've explained or wrote in the book, is that my whole life passed as if it was on a canvas, just spread across me. My childhood, the ocean where I played, school I went to, my grandmother, my sisters, my siblings. And then through college years to where I was, it was just like a brief visual just shone across me, and I was just laying there. And it would surprise me that something is pulling that line of visuals through me. And so those two were the profound memories of that moment.